Good afternoon. I'd like to encourage everyone to take their seats so that we can get started with this afternoon's event. And I'd also like to welcome you all to the Brookings Institution today. I'm Mark McClellan. I'm the director of the Engelberg Center for Healthcare Reform here at Brookings, and it's a pleasure to welcome you all to today's event on new policy directions for biomedical innovation. Today's conference is part of a series of research and public activities that we're undertaking related to biomedical innovation. Some of you participated in our conference in June on the state of biomedical innovation. I'm going to come back to some of the implications from that conference in a few minutes. And we've also covered in recent events improving the clinical development pathway and the regulatory review process, as well as new reimbursement paradigms to promote biomedical innovation and ensure that we're getting maximum economic value from all of our work to improve biomedical sciences and apply those breakthroughs to patients. Today is another step in that process, and it's a step that is made possible importantly by the generous support of the Irene Diamond Fund. The fund has made a major gift to the Engelberg Center this year to support the Irene Diamond Fund for Healthcare Innovation and the Irene Diamond Fellowship for Public Health Leadership. And so before we start, I want to take a moment to thank the fund for their generous support and their continued dedication to improving the public health. I expect that not many people in this room knew Irene Diamond personally, though if you look up her bio, you may know some of her movies and some of her contributions to philanthropy over the years. But she, in her life and in her foundation, has been distinguished by supporting innovative, you might say, or outside-the-box approaches to dealing with important public problems, especially public health problems, whether that was earlier on issues related to HIV and communicable diseases and innovative approaches to research in those areas. More recently, issues related to aging and public health. They all have a common theme of trying to take a fresh look at issues that have been part of the public policy debate for some time, but where nonetheless we continue to struggle. And one of those areas is biomedical innovation. This should be the century of biomedical innovation with all of the breakthroughs in genomics and information sciences and ways of putting this all together for more precise, accurate, timely, prevention-oriented treatment of diseases, influencing diseases even before they have consequences for patients. But getting from here to there has proven to be challenging. And in our work on innovation, we're trying to look at the whole innovation process, the basic sciences progressing into evaluation of treatments in people, the process for demonstrating the safety and reliability, the safety, effectiveness, and reliability of those treatments, and then on after treatments reach the market to promote their most effective use, to improve health and get the most value for patients. While there is no question that biomedical innovation has added tremendously to the length of lives, the quality of lives of Americans and people all around the world, we are facing some real challenges, as our earlier work and much of the work of many of our participants today has identified. These challenges include the challenges of a constrained fiscal environment where the resources available for all discretionary, so-called discretionary federal programs, including biomedical research, are tighter than ever. They're constrained by some of the issues that we've addressed in previous meetings in our innovation work, such as that June meeting where some evidence was presented on the declining productivity of private sector investments in biomedical innovation. And putting all that together means that we are at a very challenging time in turning the promise of biomedical sciences and innovation into reliable, effective, beneficial, and affordable treatments for patients. At the same time, there are some unprecedented opportunities to make progress on these issues. And we're going to start with some of the recent ideas that have been put forward to try to make progress, to try to go beyond seeking more money in a constrained fiscal environment to changing the way that the innovation process works. In September, the President's Council of Advisors on Science and Technology Policy outlined a number of opportunities to do this, and we're going to use that report as a starting point for today's discussion. Copies of the executive summary of the PCAST report are available at our registration desk out the back, and I hope you all have had a chance to look at it. You're going to hear more about it from our first speaker. After starting that discussion with the PCAST report, we're going to hear from a number of different perspectives on ways to improve the impact of the resources devoted to biomedical research and innovation. These include some novel approaches being pioneered by some of the speakers who you'll hear from this afternoon, all of which collectively may point the way to some important new steps in the biomedical innovation paradigm. So we'll begin with a focus on the PCAST report itself, what its key recommendations are, and how they might have an impact on addressing these challenges and opportunities in biomedical innovation. Then we're going to hear from a panel to discuss ways of extending those ideas. Starting out with the PCAST report, we're going to hear from Ed Penhote, who is one of the PCAST members who authored this report. He's currently a director with Alta Partners working on biomedical innovation issues. And then we're going to hear from a number of different perspectives related to these ideas on biomedical innovation. This includes a panel discussion with Christopher Austin from the National Center for Advancing Translational Sciences at NIH, John Mendelson from the University of Texas MD Anderson Cancer Center, Debbie Brooks of the Michael J. Fox Foundation, Robert Conley from Eli Lilly, and Earl Steinberg of the Geisinger Health System. These distinguished panelists are going to help address what they see as opportunities for improving the promise of biomedical innovation. In some ways they will build on, in some ways they might provide some counterpoints to the issues discussed in the PCAST report, but what they all have in common is an emphasis on new ways of going about solving the challenges in biomedical innovation that we're facing today, ways to reduce the time, ways to reduce the cost, ways to reduce the uncertainty, ways to increase the productivity of the biomedical research enterprise at a time when, on both the fiscal side and on the productivity side, we really need progress like this. Today's event is a public event. There are press present with us, and the event is being webcast and recorded, so everything here is on the record. I want our panelists, as we get to that in a little while, to be mindful of the time. We want to keep plenty of time for discussion of the key ideas that get brought up, and John Berard, who is up front, is going to help us keep on track with all of that. During the course of this event, there will be several opportunities for participation from all of you, and we do very much intend this to be a dialogue-oriented discussion. There are not going to be any PowerPoints presented. It really is about getting some ideas out and then exploring them further. So we'd encourage you to participate too. There will be some of our staff with roving microphones walking around the room to help you make sure you're heard when you ask the question. So when we get to that point, just raise your hand and we'll get a microphone to as many people as possible.